of Health for Alberta. I'm here today to announce that 3 new cases of COVID-19 have been detected in our province. These are the 5th, 6th, and 7th cases of COVID-19 in Alberta. Case 5 is a woman in her 70s from the Edmonton zone who is a close contact of an Edmonton zone man announced on March 6th as a presumptive case of COVID-19. She was also on board the Grand Princess cruise before returning to Alberta on February 21st. Case 6 is a man in his 30s from the Calgary zone. He is a close contact of the Calgary zone woman announced yesterday as a presumptive case of COVID-19. He had traveled to Ukraine, Netherlands, and Turkey and returned to Alberta on March 2nd. His symptoms began after his return. Health officials had already reached out to all individuals who may have been in close contact with both of these new cases as a part of the previous investigations. Identifying close contacts who have been exposed to COVID-19 is an important part of Alberta's response to this outbreak. As I mentioned yesterday, COVID-19 does not spread like measles. It does not travel through the air over long distances or times. However, it can spread person to person by larger droplets, like from a cough or sneeze, or by touching contaminated objects, then touching your eyes, nose, or mouth. This means that close contacts are the ones who are at the greatest risk of contracting the virus, so these new cases are not surprising. Again, quickly catching these cases before they have a chance to spread is exactly what our approach is designed to do. In addition to these 2 cases, a 7th case was also identified yesterday. Case 7 is a woman in her 50s who returned from a Caribbean cruise on the MS Braemar cruise ship on March 4th. Her symptoms started after her return. She was tested yesterday at the Calgary Assessment Centre, and her test came back positive late last night. All 3 new cases are in isolation at home and are expected to make a full recovery. These cases are examples of public health in action. Over the weekend, countless hours have been put in by our staff all over the province to make our system work. I particularly want to highlight the incredible work done to get assessment centres running over the weekend, expanding capacity at HealthLink, and tracing contacts of cases. I want to make special mention of our provincial public health laboratory, where capacity for running tests for COVID-19 has dramatically increased. Yesterday alone, 700 tests for COVID were done, meaning that almost 1,000 tests have been completed in Alberta in the past 2 days. This is a remarkable accomplishment, and it is a testament to the fine healthcare professionals in this province. All cases of COVID-19 announced in Alberta are now confirmed. From now on, positive samples tested by Alberta laboratories no longer require further confirmation from the National Microbiology Laboratory in Winnipeg, as the samples that were tested here have been confirmed as valid by tests in Winnipeg. The events of the past week, both in Alberta and globally, are significant. More countries around the world have cases, and some of these countries are grappling with large outbreaks. At this point, it is likely that we will be dealing with the virus worldwide for many months to come. I want to be clear that this virus is not influenza. In cases in China, about 1 in 5 of those infected with COVID-19 had a severe illness, which is much more than we would see with seasonal influenza. Several weeks ago, influenza was a greater threat to Albertans because there was very little risk of exposure to COVID-19 cases globally. The global picture has changed, and while the risk of exposure to COVID-19 in Alberta is still low at this time, worldwide the risk is rising. What does this mean to Albertans? It means that all of us need to be engaged in this response. We need to start thinking about what our new normal will look like over the coming months. With no vaccine for this virus likely to be available for a year or more to protect the population, we need to protect each other. We can do this by covering coughs and sneezes, washing hands regularly, and most importantly, we need to stay home and away from others when we are sick. It is time to start greeting each other with elbow bumps or waves instead of handshakes. This is not an overreaction, but a very practical way of limiting the spread of germs. I want to particularly underline that if you are sick, do not visit loved ones in hospitals or long-term care facilities. People in these locations are at the highest risk of complications for both influenza and COVID. All returning travelers from anywhere outside of Canada need to be vigilant for illness, quickly isolate themselves if they should feel ill, and call 811 for assessment and testing. Do not go to an emergency department, urgent care centre, or family doctor's office for this assessment. Instead, 811 will direct you to the assessment centre nearest you or home testing where capacity is existing in those zones. While the current risk of catching the virus in Alberta remains low, this may change in the coming weeks. Regardless of risk level, we will continue taking whatever steps are necessary to minimize risk and keep Albertans safe. Together, we can protect each other and keep our communities healthy. We will continue to keep Albertans fully informed as events unfold in the days ahead. Our top priority is and always will be protecting the health of Albertans. Thank you again for coming, and I'm happy to take any questions you may have.
How much more serious is the situation becoming with 7 cases over 5 days in the province?
So with respect to the situation in the province, the good thing is that all the cases that we've found have been travel related. So of those 1,000 tests that I mentioned have been done in those last 2 days alone, I don't have the specific proportion, but though some of those tests were done from samples of people who hadn't traveled. As I mentioned earlier, we are taking some samples from our influenza testing as a safety net. And so far with that, again, large volume of testing, we have only found 7 cases, and again, all of them have been related to travel.
And as things stand right now, do you think it will still be possible to contain the virus in Alberta?
So that's our goal right now, and that's what our efforts are focused on, is containing. So again, quick identification of cases, expanding our lab testing was the right thing to do. This will help us make sure that we can detect cases as quickly as possible and make sure that protective measures go in place around them. And so our goal is containment.
Can you walk us through just someone, they're at home, they start having symptoms, just their process? Can you walk us through what their process would look like?
Mm-hmm. So someone at home, they've returned from travel within the last 14 days. They start to feel sick, maybe have a cough or a fever. So we would want them to call HealthLink. They may end up waiting for a little bit of time. We know that there are some wait time issues, particularly at peak points in the day. I'd ask that people be patient, and I appreciate people's patience as they wait on the line, because once they get through to the nurse who is assessing them, then that nurse can go through the questions about where did they travel, how recently they traveled, what their symptoms are, and then it depends where they are in the province. So in Calgary and Edmonton, there are assessment centres open, and so typically in those places, that person would be directed to go to the assessment centre that's close to them, and then they would go through the process. They would be put a mask on at the door, they would be greeted by a healthcare professional, and they would have a swab taken after they're assessed to make sure that they're stable, and then they would go home with a note that gives them instructions on what to do while they're waiting. We do try to get the samples tested as quickly as possible. As I mentioned, our 7th case did have results back the same day, but it does depend on our lab volumes, when the tests are run, and if it's in a rural area, sometimes the transport time to the lab can also add a bit of time. So the estimate we usually give people is up to 4 days. We do try our best to get it back as soon as possible, but we do ask people to stay at home and away from others while they're waiting for that test result to come back. Then they would be contacted by public health to let them know that the test result is negative and they can go about their business, or if the test result is positive, then they would be advised on what to do next and continue the isolation measures that they would have implemented when they were first tested.
Anna?
You used the phrase testing centers a couple times. Can you tell us a bit more about where those are located and how people might access them?
So I don't actually have information on the specific locations. They're in Edmonton and Calgary, and they're accessed through HealthLink. So again, the centers are only for people who've gone through that triage process. We are focusing those centers on those who've traveled. Those individuals who've traveled in the last 14 days and have those symptoms would be considered to be at the highest risk of being exposed. And so those people, again, through HealthLink would be told what the location is, where to go, and then they could go through, be tested, and then go home again.
When do you expect assessment centres to be open in other zones in the province?
Assessment centres, plans have been made in all zones, so essentially it depends on volumes. there are different teams across the province who can do home tests. And so if there's still capacity within a particular zone or location to do home tests for people who've traveled and are sick, then that's the mechanism that we would use. It doesn't really make sense to set up an assessment center if we can manage the volume with people who go to people's houses. As that volume increases, if those home testing teams can't keep up with demand, then that's the trigger for an assessment center to open.
All right, operator, we'll go to the line first and patch through first question, please.
First question is from Bob Weber with the Canadian Press. Bob, your line is open.
Hi, thank you. Doctor, can you tell us a little bit about the kind of resources it takes to conduct 1,000 tests for this virus over the course of a weekend? And as a follow-up, I'd like to know if any of those resources are likely to be affected by changes in the recent provincial budget.
So with respect to the kinds of resources it takes, I would underline that the lab testing is incredible. So again, going from a handful of tests each day to the announcement on Friday of expanding our testing protocols to being able to test 1,000 people in 2 days is remarkable. That takes in not only a lot of extra people, so calling in extra people to run those tests. There's obviously equipment, there's reagents, there's the swabs that need to be taken. But if you walk that backwards, the swabs that go to the lab to get tested need to be taken from patients. So the incredible amount of work it took to stand up the assessment centers in Edmonton and Calgary, ensure that in rural places those home testing teams were ready for the increased demand, and also to resource HealthLink, again, as we've talked about before, extra resources were needed to make sure that the call volume could be dealt with. And so all of those things, from the very front end where someone makes a call to the end result where the test comes off the lab, and then in those few cases that have been positive, again, 7 out of more than 1,000 tests, then those few cases that are positive, there's also a huge amount of work that's done by our public health contact tracing teams to contact those cases, find out who might have come in contact with them while they were symptomatic, follow up with all of those people, give them instructions on how to self-isolate, what they should be thinking about, do they have symptoms, arranging tests for those people. So again, there's quite a huge team that's been working on this over the weekend, and really want to celebrate that work. With respect to budget, really, we're being supported in this as an urgent response. So this particular response is being resourced appropriately to the response urgency, and so I don't think that there's any issue with that resourcing.
Excellent. We'll take 2 more on the phone, and then we'll come back to the room. Operator, could you patch through another one, please?
Next question is Robert Peddle with Bloomberg. Robert, your line is open.
Yes, hi. You mentioned that 2 of these people were on cruise ships. Any idea how many people are currently on cruise ships from Alberta or coming back, or in particular, how many are coming back from the ship off California?
So I don't have specific information about Albertans on the ship off California. And of course, that's a question that I think would be difficult to answer, how many Albertans might be on cruise ships around the world. What I do know is that the National Public Health Officer, Dr. Theresa Tam, did today indicate that nationally they are putting out a travel advisory for cruise ships. We do recognize with these cases that have been coming back that cruise ships are a particularly concerning environment for spread. And so that travel advisory, again, nationally went out. And so I think what we need to do is make sure that Albertans know of the risks, especially with spread of this virus happening around the world, and that being in a contained environment like a cruise ship is a particularly high-risk situation.
Operator, can you patch through one more? Oh, sorry.
I mean, is there any special measures you're taking with people coming back from cruise ships, or from, in particular, the one in California? Should they be immediately go into quarantine, or I mean, self-isolate, I mean? Sorry.
So with respect to the ship off the coast of California, that's work that's being done with the federal government in terms of those Canadians that are on that ship. So that's something that they would be able to speak to, whatever measures might be taken for that particular one. Certainly, having had this one case from another cruise ship, we've been working with the Public Health Agency to understand if we can get a list of the passengers who might have been on that particular ship, because what we did for the Grand Princess is got a list of all the passengers who were aboard, who'd come to Alberta, and then followed up with them. Our public health teams made those calls to make sure that we knew if they were ill or not. If they were, we tested them, which is how we found some of our cases. And then also, if they weren't ill, that they knew they had to stay at home and be on isolation for 14 days after they left the cruise. So again, we're working very closely with the federal government to assess what our actions should be with respect to cruise ships, but it's certainly an environment that we're concerned about.
A couple questions in the back. City News first.
Containment obviously is a big factor with this virus. When we look at other countries that have been impacted by it, they've done things like sporting events in front of empty buildings, canceled concerts, that type of thing. Mm-hmm. Where are we on that line? Who makes that decision? What's the criteria for that? Mm-hmm.
Again, questions I know a lot of people are asking. So with respect to criteria for when an event might be cancelled, the Public Health Agency of Canada has put out some general guidance on what kinds of factors to take into account when considering whether an event is high risk or not. And those factors might include whether or not people are coming from around the world to an event, whether it's a local event that has a lot of people, what types of people would be at the event, those kinds of factors. And are there things that can be done? So is it an event where there could be some virtual component introduced to reduce the risk? So those are the kinds of considerations that are taken into account in discussion with event organizers. With respect to final decisions on cancelling an event, again, event organizers are free to cancel at any time. With respect to public health advice on that again kind of depends on the magnitude of the event, who all is impacted, and who would make that final decision with respect to either saying this event must be cancelled or it can go ahead with these particular precautions. With respect, again, to the Alberta context, we are assessing the risk of exposure in this province still as low. But we, of course, are concerned if there are events where there's multiple international people coming, and those are things we're watching closely. But as you know, this is a rapidly evolving situation, and so we're making decisions based on current evidence as well as collaborating with colleagues across the country to ensure that as a country, we're being consistent and using best evidence to guide our actions.
Just to jump off that, what would be the threshold here in Alberta, whether it's number of cases or even if there are deaths for those types of public community gatherings to be canceled? Mm-hmm.
So again, I think it would depend if there was a case where we had seen perhaps an exposure in a large community setting. We might take some of those actions more quickly, and it wouldn't depend on how many cases. It's more about what exposures are around a particular case. The other thing to consider is, certainly seeing the spread across the globe and around the world. If there was an event where we were concerned that people who were coming might be coming from countries where there is spread, then we would be very concerned about that, even if we didn't have any cases. So the issue of what to do with mass gatherings, again, depends on many factors, not just on our current state of how many cases we have in the province.
Leduc High School sent out a letter to parents saying 2 of their students had direct contact with someone who's tested positive for COVID-19. They're and their families are now self-isolating. Are they being tested, those students, or are they following sort of what they should be doing?
So again, local public health has done all of the contact tracing for all of our cases. So I don't necessarily have the specific details of all the different contacts, but what I can tell you is that any close contact of somebody who's a confirmed case would be first assessed whether or not they have symptoms. And if they're perfectly well, they have no symptoms, they are not a risk to other people. And I think that's a really important point because we've seen some concern where someone knows a close contact and they kind of treat that close contact as if they are a case. And I think we need to distinguish between cases or people who have symptoms and have been tested positive, and then around them we have contacts. If a contact is ill, they would be called a person under investigation, and so they would be tested immediately. If they are well, again, they're called a close contact, and they're asked to stay home for 14 days as a precaution to make sure that if they should get ill in that 14 days, they're not in a public place when that happens. But while they're well, they're not a risk to others. So again, with respect to that particular school, I can't comment on the details, but it's important to know that if there were to be an exposure of concern in a school setting, that Alberta Health Services would be the one to be sending notifications to parents if a school setting was concerned was deemed to be an exposure setting of concern. I am not aware that there was any school exposure setting of concern with respect to our recent cases. So again, my understanding based on what you've said is that there are close contacts, but no exposure of concern within that school itself.
So does a close contact then, would a whole family need to isolate if there was a close contact within their home? Or where does that line get drawn?
Yeah, for sure. So let's say you had a family and one person was a confirmed case. The entire family who lived in that house would be considered to be close contacts of that person. The person who's the case would be asked to stay in a separate bedroom, ideally, if possible, to use a separate bathroom. If that's not possible, there's certain cleaning protocols that would be put in place. The rest of the household would be separate from that case, using, not sharing utensils, those kinds of things. There's very specific guidelines that are given by public health about how to keep that separate. For cases, public health is contacting those cases every day to make sure that they're keeping in touch, understanding what's going on, are there issues, and then if there are issues within that family setting, they can help resolve them. But those close contacts would need to stay separate from that case for 14 days. And if they're totally well during that time, then they're able to go about their business. But if they get ill during that time, then again, they would be tested immediately and they would be asked to, again, isolate in a separate place.
You talked about how testing has been ramping up. We've heard about test shortages in the United States. So what's the situation here in our province?
So far, the lab has not indicated to me that we have shortages of any supplies.
Also, what is the capacity for ICU care? Are hospitals prepared for possible influx of patients? And then I have a follow-up after that.
Okay, so our hospitals certainly have been preparing for the event that we should need more ICU capacity than average. So things like ventilators, for example, have been retained, so we have extra ventilator capacity beyond what we typically would. And our health system does pandemic planning on a regular basis to be ready for these kinds of events. And so they have different criteria in terms of if the system were to start being put under pressure, what are the kinds of procedures or care pathways that might be deferred without risk to patients in order to expand capacity for those who are at highest risk. And so that really depends on each individual kind of zone, each individual care group has their own plans to determine what would happen if they should need to ramp up capacity.
So then at this point, have any procedures or any type of tests been put on pause as of right now, or are you guys waiting for that down the line?
So the only thing that's been put on pause is really about lab testing. So as you can imagine, in order to free up capacity to do 1,000 tests in 2 days, there are certain tests that have to do more with our public health surveillance. So it is really important that we understand what kinds of viruses circulate in the province every year. And so some of the tests that are done are helpful in that regard. And so we have stopped some of those tests, so that doesn't compromise clinical care in any way, but it does expand our capacity for our priority at the moment, which is COVID testing.
Operator, we'll just pass through a couple more questions, and then I'll go back to a final one here in the room. Could you put one through?
Next question is Jennifer Lee with the CBC. Jennifer, your line's open.
Hi, thanks for taking my question. Dr. Hinshaw, I'm wondering, given that Canada has seen its first COVID-19 related death in BC, an individual in a long-term care facility, I guess how concerned are you about folks who are in those facilities and what is being done on the ground to sort of protect those folks?
Yeah, again, that is absolutely an area of concern, and it's one that we've been working to make sure that we have clear guidance to give to long-term care operators. We have been communicating with long-term care operators with respect to high-level guidance on the kinds of things to be watching for, healthcare worker, making sure that any workers in long-term care understand that if they're ill, they should stay home. It's always a recommendation, but it's particularly important at this time. We're also making sure that if healthcare workers who work in long-term care facilities are feeling ill, that they are rapidly tested. Again, there's an extremely low risk of community spread. These are just extra measures that we're taking as an added precaution because long-term care centers are extremely high risk if there should be an introduction of the virus into them. Alberta Health Services has made sure that long-term care centres have resources such as signs to post on the door as a just-in-time reminder that if somebody's going to visit, they should not visit if they're feeling ill at all. So trying to, again, reinforce that message that for this particular virus, we are each other's best protection, and making sure that people remember that the actions they take if they're feeling ill are not just about themselves, but about other people. So those are the kinds of concrete things. We also have some specific planning groups working through issues as long-term care identify issues. We have a team working with multiple ministries, with Alberta Health, with Alberta Health Services, so that we can troubleshoot and help support long-term cares as they identify problems.
Operator, could
Can
you...
I ask, has any thought been given to maybe preventing visits in those facilities at all?
So as we've done all along, we've acted out of caution, but also with a balance while we look at the risk of the situation. And as I mentioned in my remarks, how we respond to this virus is something that we're going to need to maintain for many months. And we know that as humans, all of us, not just seniors, having company, having people to talk to, having social interactions is a really important part of our health. So it's critical, again, that people who are ill not visit, but I think to restrict all visitors to long-term care facilities when, again, we have a very low risk of exposure in the province, if we initiated that, again, that would likely go on for many months. And so kind of weighing those risks against the risks of isolation, the risks of loneliness. And so we're making judgments based on weighing all of those risks and recommending right now that really it's just people who are feeling sick should not visit. If people are feeling well, then they can visit their loved ones. And again, trying to take that balanced approach.
Operator, could you patch through the next question?
Next question is from Emily Keller with Everything GP. Emily, your line's open.
Hi. I was just wondering, in regards to panic buying or stocking up, is that something that you believe is necessary right now?
No, I don't. So we always recommend that people have about 72 hours worth of supplies for any emergency. And that's typical advice you'll always hear for public health, like you'll always hear us say, wash your hands. In this particular scenario, I think people are seeing what's happening in other countries, maybe getting worried and then starting to go out and buy large amounts of things. And that behavior in some ways creates the problem that they were afraid of. So it sort of reinforces that vicious cycle. But in this particular scenario, what's most important is if people, again, think about who's in their neighborhood, who's in their family. If they were to be asked to be self-isolated, so if it's somebody who was in close contact with a case and they needed to stay home for 14 days, who could help them get groceries? Does their pharmacy deliver medications? There are other ways of getting those kinds of products. If you do have to stay home for 14 days, it's not necessary for every household in Alberta to have a 14-day stock of all critical supplies. This is something, again, that we can work together as communities and help support each other.
All right, we'll take a final question here final two questions here in the room.
Just kind of going back to the testing center, do you know anything about whether the East Edmonton Health Center is being used as one of those, or if it's being prepared as a special site for COVID-19 issues?
So my role in this response is to kind of look at that overall policy and the strategy that guides it, but I'm not involved in the operational details at the zone level, so I wouldn't be able to speak to which sites have been chosen in which zones.
We can look into that for you.
Sure, thank you.
Sorry, this is a two-part question. Have all test results from passengers who were on the Grand Princess come back at this point? And then the second question is, are you aware of how many Albertans may have been on the second cruise ship?
So for the first question, all of the people who had been tested, their test results have come back. So again, we have 3 people in Alberta who were on the cruise, 1 person who was a close contact of someone in BC who was on the cruise. And the other people who in Alberta who were on that cruise either were asymptomatic or if they were symptomatic have been tested and been negative. There were 2 individuals who I don't have the information on. So of the 44, there are 2 who I don't have that final information on. But of all the other 42, everything's been completed in terms of follow-up.
And then for the MS Braemar cruise ship, are you aware of how many were?
So again, it was just late last night that we got that positive. So we're working with the Public Health Agency of Canada to understand the situation on that cruise ship. And so we don't have any further information at this time.
Thanks, everyone. Obviously, events continue to unfold, and we'll keep you updated again tomorrow. about which cases these were all connected to? It's a bit confusing, I know. Okay, good. I had to do a cheat sheet just to make sure.
Draw like a diagram.
It's a table.
Okay.
Okay, just wanted